Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with important MCQs, which are helpful for your competitive exams. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. A 5-year-old child shows visible wasting, low weight for height, but normal height for age. What type of malnutrition does this indicate? Options are given. Right option is B, that is acute malnutrition. Next question. Which of the following is not an anthropometric method of nutritional assessment? Options are here. Blood pressure. What does MUAC less than, that is mid-arm circumference? Mid-upper arm circumference less than 11.5 mm in children under 5 years indicate? What is severe acute malnutrition? Which biochemical test is used to assess protein status in malnourished individuals? Serum bilirubin. Which index is best for assessing wasting in children under 5 years? Right option is C, that is weight for height. The body mass index threshold defining obesity is? Option D, 30. Which method is used to study usual dietary intake over a longer time? Food frequency questionnaire. Clinical signs of malnutrition usually appear? That option is only in severe or prolonged deficiency. Which type of malnutrition is characterized by edema, fatty liver, and hypoalbuminemia? Right option is B, that is kwashiorkor. What nutritional deficiency causes goiter? That is iodine deficiency. The condition characterized by growth retardation and short stature due to long-term malnutrition is called? Stunting. Vitamin A deficiency mainly causes? Is A, night blindness. Which nutrient deficiency causes anemia due to poor hemoglobin synthesis? Iron. The energy yielding nutrients are? Right option is carbohydrates, proteins, and fats. Marasmus differs from kwashiorkor by? Right option is presence of edema. Which of the following is a common symptom of vitamin C deficiency? Scurvy. Which vitamin deficiency causes rickets in children? Vitamin D. Which of the following is not a micronutrient? Carbohydrate. Anemia due to folate deficiency is called? Megaloblastic anemia. Which of the following vitamins is fat soluble? Vitamin A. A 45-year-old pregnant woman complains of fatigue and pale skin. Blood tests show iron deficiency anemia. Which diet modification is best to improve her condition? Right option is A, that is increase intake of red meat, leafy greens and vitamin C rich fruits. A patient with a type 2 diabetes is advised to control blood sugar through diet. Which of the following meal plans is most appropriate? Right option is B, that is balanced meals with whole grains, vegetables, lean proteins and moderate fats. Next question. Best to support recovery. Right option is B, that is continue breastfeeding or age appropriate feeding and oral rehydration therapy. Please like, share and subscribe to my YouTube channel for more informative topics. Thank you for watching.